Cervical cancer causes, symptoms, and treatments. Cervical cancer is characterized by the growth of abnormal cells in the cervix's lining, predominantly a squamous cell carcinoma. It's a significant health concern, with over 900 diagnoses in 2023, mostly affecting individuals around the age of 50. The introduction of the National Cervical Screening Program and the HPV vaccine program has significantly reduced cervical cancer incidence, highlighting strides towards elimination by Australian researchers. Key symptoms include unusual vaginal bleeding, pain during intercourse, and changes in vaginal discharge. These signs often go unnoticed until the cancer advances, emphasizing the importance of regular screening. HPV, particularly high-risk types, is the primary cause of cervical cancer. Smoking and prolonged use of contraceptive pills in individuals with HPV also increase risk factors. For diagnosis, specialists may conduct colposcopies with biopsies or employ procedures like LETs and cone biopsies to remove and examine cervical tissue, essential for detecting precancerous changes or early-stage cancer. Upon a cervical cancer diagnosis, patients often experience a whirlwind of emotions. It's crucial to discuss treatment options and gather information to navigate the journey ahead. Treatment varies from surgery for early stages to a combination of radiation and chemotherapy for advanced cases, meticulously planned based on the cancer's stage. A multidisciplinary team supports patients through this process. The shift from Pap smear tests to the more effective cervical screening test, complemented by the HPV vaccination program, marks a pivotal advancement in cervical cancer prevention and early detection strategies in Australia. The HPV vaccine, available through school-based programs, significantly reduces cervical cancer risk, yet regular screening remains critical. Early detection plays a crucial role in the successful treatment and prognosis of cervical cancer, emphasizing the importance of awareness and proactive health measures. Cervical cancer causes, symptoms, and treatments. Cervical cancer is caused by abnormal cell growth in the cervix, primarily from HPV infections. Squamous cell carcinoma is the most common type, making up 70% of cases. Adenocarcinoma, though less common, is harder to detect. Over 900 people were estimated to be diagnosed with cervical cancer in 2023, with the average age of diagnosis being 50. The incidence of cervical cancer has significantly decreased due to effective screening and vaccination programs. Cancer Council researchers are on a quest to help Australia eliminate cervical cancer. Early detection through cervical screening tests is crucial as precancerous changes rarely show symptoms. Common symptoms of cervical cancer include unusual vaginal bleeding, pain during intercourse, and changes in vaginal discharge. These symptoms warrant immediate medical attention to rule out cancer. Key risk factors for cervical cancer include persistent HPV infection and smoking. Long-term use of contraceptive pills in individuals with HPV may slightly increase risk, though the pill reduces the risk of other cancers. Diagnosis involves a referral to a specialist for further tests, including colposcopy with biopsy and possibly a large loop excision or cone biopsy depending on the findings. After a diagnosis, feelings of shock and anxiety are normal. Discussing treatment options and seeking information from doctors can be helpful. Treatment depends on the cancer stage and may involve surgery, chemoradiation, or chemotherapy. The cervical screening test has replaced the Pap smear in Australia, aiming for early detection. The introduction of the HPV vaccine and changes in screening practices are crucial steps towards eliminating cervical cancer. Preventing cervical cancer involves the HPV vaccine, which is effective against the types of HPV that cause most cervical cancers. Regular screening is essential, even for those vaccinated. Early detection offers the best chance for a cure.